I am Nurul Hazika binti Zuhaimi, and I save lives by being the eyes and ears of our patients. I work in Geriatric Special Care Dentistry Clinic. Most of my patients are the elderly with 4 risks or dementia. For the safety of my patients, I stay focused and also pay attention to the smallest details. During dental treatments, I help assure patients by showing them the dental instruments such as mouth mirrors and explain each step before they see the dental specialist. Sometimes we take certain things for granted, but these are the things that can actually be quite overwhelming to our patients. I help by being their eyes and ears. I comfort and reassure them and keep them safe from harm while they are seeking treatment with us.
I am Jenny Yap, and I save lives by working like a private investigator. Success comes when hiring the right people. A lot goes on behind the scenes during the hiring process. The interview is just the tip of the iceberg. My colleagues and I have made it our mission to check and verify the credentials of potential new staff. We make sure they are medically screened and certified fit to work to prevent any risk exposure to patients and fellow colleagues. By making sure the people we hire have the right qualifications and licenses, we protect the organisation and our patients from harm.
I'm Dr. Chan Tak Tiong, and I save lives by advocating mindfulness. As a lead surgeon, before I perform any invasive procedure, I would like to ensure that my team adheres to the strictest standards of ophthalmic surgery. We require a certain level of cooperation with the patient during the surgery. As such, I thoroughly need to brief my patients to tell them exactly what to expect during the surgery, and this would allay their anxiety and concern. We could have done the same surgical procedure many times before, and every time it worked like clockwork. But remember, every patient is different. That is why I advocate mindfulness. We do not rush at the expense of breaching safety limits. We do not take any shortcuts. We can all save lives by being mindful.
I am Fede Leon, and I save lives by raising the alarm. Actually, I was on night shift. I be serving the last dose of the medication for my patient. So I'll go to the AMC and take the medication for my patient. But I noticed that the medicine prescribed and the one in the AMC was different, so I didn't serve the patient her medicine. I could have just obtained the right medication and ignored the nagging feeling in my head, but I did not. I rechecked the medicine cabinet and discovered that the cubicle intended for medicine A was accidentally packed with another medicine. Immediately, an alarm bell sounded in my head. I take out all the medication and highlight it to my supervisor. I'm glad that I actually raised this alarm to prevent my colleagues from serving the wrong medication to the patient, so we kept our patients safe.
I'm Oh Hui Ping, and I save lives by digging deep. Some of our patients have metal implants or prostheses which may be unsuitable for MRI and require special care and handling. I am meticulous in conducting multiple safety screening checks on patients going for MRI scans. This ensures that the process is safe for each and every one of them. I also work with different specialties and departments to augment our screening processes and promote a safety culture. There is no mountain too high when it comes to our patient safety. I save lives by performing multiple safety checks and embedding these steps into the work culture for my colleagues.
Together we save lives. And you can too.